introduction. Thank you all for joining. The goal of this presentation is not to tell you any one thing, but it's really to inspire you to ask questions. Much like Lindred said on the main stage, she said a really good question to ask is why? And that's the question when you think about analytics and when you think about analyzing the conversations and the communities we see online, you should be asking why. Why are these people talking, but not those people? Why are these groups separate, or why are they talking together? Who is missing from the conversation, and why don't they know about it? Should they be part of it? So I want to start to talk through some of those questions and give some examples and kind of prompt you to start thinking about it. But just to quickly answer the where, the how, and the why, I'm going to be talking about online, obviously. Yes, there's other things we can do with measuring offline community interactions and conversations, but I'm going to focus online, and the how is with analytics. And through my work with Digital Life at W2O Group, we have a cool set of tools that helps us do it. But I'm going to give you some tips to help you, whether you're an individual patient, an individual doctor, an entrepreneur, whatever role you're in. If you want to dig deeper into analytics, I want us to push beyond impressions and the first metric you see and help you think about how to look critically at these metrics. And the why is what you've been hearing on stage. This stuff matters. Patients are engaging online, we're engaging online, and observing what we do online is really critical because it helps us learn about the trends. It helps us observe behaviors that are really important to understand because what's happening online is also in some ways a reflection of what's happening offline. And I won't dwell too much on this, but when I talk to a group that hasn't had so many amazing patient speakers, I like to say, why? Like, why is the social media stuff important if you don't believe it yet? And I think this is a great example of Lisa Bernstein last year during the BCSM breast cancer social media chat when I think in December said, you know, we should have this bat signal so that over the holidays, if you are feeling alone, you're feeling stressed, you need some connections, you just need a moment of hope, of help, you can put out the bat signal. And she later in December said, is anybody out there? And everybody responded. It was just response after response after response. It was patients, it was doctors, it was people in the industry. And there's just this beautiful overwhelming of, I'm here, how can I help? I'm listening. And it gives me chills to think about it every time because it's just so powerful where anywhere in the world, if you have internet connectivity, you can find that support, even if you can't find it in your physical everyday life. And it's just so incredibly powerful. And the reason I'm so passionate about this is because there's a lot that's wrong with healthcare. We all know that. We often say, oh, healthcare is 5 or 10 years behind. But when you think about social media analytics, we don't have to be 10 years behind in healthcare. We can be right up with everybody else, and that's what I want to challenge us to do, is to be up here in the presence, be on the bleeding edge, and demand more from our healthcare analytics. And my big pet peeve in this world is when somebody puts out, there have been 8 billion impressions from a conversation. And I'm like, well, that's interesting, but that doesn't really tell me anything because impressions is technically in a metric about potential impressions. It says if everybody who follows this account is online right now and staring at that tweet, that's an impression. But reality, who here sees every tweet of every person that they follow? Nobody, right? You're not going to see everything. So that potential impressions is just theoretically, this is the widest possible reach this tweet could get, but it's not really reality. And the same thing, though, is true if you look at the number of followers or the number of posts or the number of mentions. This is potential data that starts to help us put some edges on what we should think about, but it's just the beginning and it's a really one-dimensional perspective. And I want to talk about some ways that we can do better with this. And when you think about analytics, oftentimes we think about that last. Oh, we did something, now let's measure it. But if you work for a company or you're launching a product, you need to do analytics first. And I know there's a lot of patients in the room. And for individuals, this matters too, because if you are trying to launch a campaign, whether it's a social organic campaign, you want to get people to understand what you're talking about, you want to get them talking with you, you need to understand where the conversation is to begin with to figure out if you're joining an existing conversation or you need to make a new conversational space. And that's why analytics is so important and needs to happen first and not just last. And something else I challenge you to think about is this model of 1990. This is a common model for online communities. It's true of Wikipedia, it's true of Twitter communities, it's true of MedX. 1% of people here are creating and posting a lot of original content. Then there's 9% who are repackaging and sharing, retweeting, for example. Oh, somebody already said that, I'm just gonna hit retweet. And then there's tons of people, 90% of people are listening and lurking. They're watching online, they're sitting in the room, and they're just soaking it all in and kind of listening and learning and taking it away from it. And it's important to think about this. Again, when you think back to that potential impressions, you're trying to say that 100% of people is going to take action on my thing. That's not true. You kind of have to have a real perspective on maybe 10%. If it's super engaging, I'm going to get everybody in the top 10%. But more realistically, you're looking at that 1% of people who are very, very engaged. And I don't have to tell you, too, that healthcare providers are online, but one thing I find fascinating for this stat, this is back in 2013, but over 54% of physicians said that they're using digital resources. They're going online, they're engaging. So it's not like patients are the only ones online and industry is the only one online. We're all online and we're all engaging. And these conversations are not just happening in silos. It's not doctors over here, patients over here, industry talking to themselves. This graph is really interesting to me because it shows over time the number of mentions that doctors make about patients, doctors talking to patients, and vice versa. How many patients are mentioning doctors on social media? And you'll just see this incredible rise and overlap showing this increasing mix of conversation. So I often see this in Twitter, where a lot of healthcare providers share these amazing patient resources and said, hey, you should talk to this patient. You should join their BCSM chat, their LCSM chat, whatever that community resource is, because doctors can't do it all. They have a very small piece of the puzzle in terms of your lived healthcare experience, and a lot of them know it. And so they're pointing to patients, and likewise, patients aren't medical providers. They're the expert, they have their PhD on their experience, but they can't treat other patients, they can't give medical advice, and so they point back to doctors and say, here's a resource, here's somebody who can help you learn more or find a provider near you. It's really powerful, and you don't, again, have to be in the same geography as other people. I love to show this to show the influence in the conversations across country, because we get asked all the time at W2O Group, well, I want to find people in this geographic area. And I push back and I say, do you want to find people in that geographic area, or do you want to find influencers of people in that geographic area? Because you might want to find influencers in Seattle that influence people in Seattle, but they're going to come from all across the country or all across the world. So you really have to look at the conversational patterns and the data to really get a feeling for where that influence is coming from, and realize that because of the beauty of the internet, it's not going to be tied to geography. So we have to think differently about how we gather and analyze that data. And so again, let's go beyond impressions. Let's think bigger. And we really have to settle for not just settling for the first glance answers, because when you get a piece of data, you're like, okay, there's conversations happening, but cost isn't a big part of them. This is a visualization of a year's worth of data, looking at IVF, conversations, and cost. Cost is a little orange blip at the bottom, not a big deal, right? Nobody's talking about cost in IVF. Well, if you look in closer, IVF cost conversations have spikes, and it's growing over time over the course of this year. So cost is a growing concern in the IVF conversation. But again, if you go back and look at this, you're like, you know, I don't want to talk about cost. Nobody's talking about cost. The reality is people are talking about cost. We often have to take another look and recontextualize the data and go deeper to really figure out what's happening and use that to form your strategy. And the other thing is, intentionally or unintentionally, some people will gain influence. You can know that one person who is just posting link after link after link after link after link after link after link to their own site. And so if you look at the number of posts, wow, this person's posting a lot, they must be really influential. Or wow, this domain, this website is being shared over and over and over again, it must be really impactful and important. But if you filter out total versus unique, the unique number of shares of that domain is really, really small, and it's all this one person. So you need to throw out that data. And that's true for looking at the number of posts, the number of mentions, the number of links, all this stuff, to throw out all that stuff that doesn't really, really matter. And so that's my one big tip for any individual who's trying to get a feel for what's important and what's actually happening. Separate, do a filter in Excel if you have to, but look at total, look at unique, and you'll be really surprised at how often there's just a bunch of spam and a bunch of stuff that doesn't really matter tucked in there. And so the questions I like to ask when I think about data, or I think about a conversation or community, what's going on? And is this person influential? And should I build a relationship with them? Should I learn more? I say, who are these people following? What is this account like compared to somebody else that I know is really credible and really influential? What are the conversation patterns? Or again, are they just sharing and sharing and sharing and sharing? And sometimes that's legit, and sometimes that's just spam. And then there's other people who are super networked and having conversations with everybody in the community. And it kind of matters to know what kind of account this person has and how they choose to use social media. And are they amplifying their reach? Are they using hashtags? Are they engaging in chats? Are they engaging in communities? Or are they just talking to themselves? And those are questions you can ask, and you can kind of, with a hunch, tell the answer to these questions, but we can also get data that helps answer these questions. And so I really challenge us to dig deeper to understand the community conversations and realize that there's a lot of overlap in these communities. And I love this visualization that just shows the overlapping networks between 4 healthcare providers, really influential healthcare providers. Wendy Sue Swanson, Seattle Mama Doc, is there, and she has a ton of healthcare provider followers. But you've got people also like Jen Dyer who technically have less followers, but she still has a lot of healthcare providers following her. And so she's equally influential in the healthcare provider space if you look at the ratio of healthcare providers to followers. And you can look at advocacy, you can look at media, you can look at the industry. So depending on who you're trying to reach, you might, if you were trying to reach doctors versus if you were trying to reach advocacy groups, you might pick a different person to say, hey, check out my content. Do you want to share it? I want to engage with you. I want to have a conversation because I might ultimately become a part of this network. It's going to differ depending on what you're trying to do and what these networks look like. And so having an image, having a picture in your head or with the data really helps you decide what action you want to take. So the premise of my presentation was a research abstract. You can read it online. I'll give a quick highlight. But originally, I wanted to look at the diabetes online community because I'm a person with diabetes. And I wanted to see how are people using hashtags. I have an idea from my personal perspective, but really looking at the data, who's using which hashtags and why? So I pulled 3 months of data from last year. There's a lot of tweets, a lot of people talking. And I used our mDigitalLife database, which categorizes people. We tag them into categories so we can kind of tell, are they talking about diabetes? Are they an endocrinologist? Are they a nurse, a CDE? Are they a patient with diabetes? And so this is the basis of the categories that I'm going to talk about. When I talk about their stakeholder role, these are the categories that we use in some subtopics to help us understand the different roles that people can play and acknowledge that sometimes people will play multiple roles. They might be a person with diabetes and a CDE, a nurse and a doctor, a patient and an entrepreneur, and so on and so forth. But I kind of categorized and picked 4 different groupings of hashtags because I wanted to see how the data looked at these differently. So we have generic hashtags like hashtag diabetes that everybody uses, flag tags like dblog or we are not waiting, where it's not so much an active conversation on this hashtag, but people put a stamp and a flag on their tweet and say, here's my blog post, dblog, or here's something about hacking our diabetes devices. This is part of the hashtag we are not waiting movement. So those are pretty obvious flag tags. And then you have the community chats. So HCPs is a general healthcare social media chat, but there's a diabetes weekly chat called DSMA, the Diabetes Social Media Advocacy Chat. And there's also other chats like DCDE and OurD, which is a UK-based chat that I wanted to include here. And then I had 2 conference hashtags that I picked, which is the big International American Diabetes Association Scientific Sessions Meeting, 2015 ADA, and then also hashtag ADE15, which is the Diabetes Educator Meeting last year. And the most interesting thing I found was just a very, very stark difference in terms of who used which hashtags. Media overwhelmingly used hashtag diabetes, but they were talking about very high-level conversations, and they weren't really engaging in conversations, which maybe could be expected. But there were a lot of healthcare providers using hashtag diabetes and just sharing media stuff. So they looked like they were a big part of the diabetes conversation, but they weren't really engaging with patients and with industry and with the rest of the stakeholders. And I found it really interesting just to look at the fact that patients themselves were using just basically every hashtag out there, including hashtag diabetes, which really surprised me. It's like nobody looks at hashtag diabetes, I think, but everybody was using it. So it's kind of interesting to say, well, maybe you should be using hashtag diabetes versus just diabetes because there's people using it, they might be looking for it, and that's another way to get your content out there. But really what struck me was that there's not a lot of healthcare providers, there's not a lot of advocacy or industry participating in these patient chats. And you probably have your own personal perspective about whether that's a good thing or a not so good thing. But I just thought it was interesting to look at the data and get a feel for it. And it really reinforced on me that every time through my work every day, or through looking at this analysis, that different people are having different conversations. And it's just really important to go in and understand the why and ask, why are healthcare providers using these tags? Do they not know about these patient communities? Do we need to educate them about it? Why are patients using these tags? That's really important. But that was 2015, and in social media, that's like 10 billion years ago. So I wanted to bring some fresh data, and so I actually looked at this year's AADE, and also because the Diabetes Social Media Chat held a DSMA live event. And I wanted to look and say, how were the interactions between DSMA and AADE, and were there increased overlapping conversations because of the DSMA presence at AADE? So what I did is I pulled data from DSMA, which is what's shown here now, and this is the weeks leading up, to try to get a feel for how many patients are involved, how many healthcare providers are involved, so on and so forth. And then I started looking at AADE, and it's important to note that DSMA happened on August 11th. So when you see it cycle over, you'll see August 10th, August 11th, that's DSMA, and the data kind of goes on from there. And there's a lot of purple, which are patients in there, compared to healthcare providers and advocacy organizations, which are the other colors. And I'll show you this map because you're like, oh my God, give me labels for those colors. So you can actually look and see, here's the combined conversation map, and you can see, interestingly, that Cherise Shockley, who is the moderator of DSMA, is that top pinkish purple dot, and she is very, very networked across all these conversations. She is a part of it all, which is not much of a surprise because she's the moderator of the chat. What's interesting is there's patients like Heather Gable and Stephen S., who are right now on the right side, but they have a ton of those lines connecting them to other people and are super engaged in the conversation. And then the other really interesting thing is if you look at those two, they look bluish, tealish dots, but that's Deb Greenwood and Hope Warshaw, who are the immediate past president and the current president of AADE. They are incredibly online. The size of their dot shows how many tweets they put out to these hashtags over this 2-week period. And they're incredibly networked, not just to other healthcare providers, but also to patients. They are conversing with everybody and pulling people into this conversation, so it really becomes a multidisciplinary conversation. That's really interesting to see. And what I learned from this, looking at this and slowing down this visualization, because if you just look at the data, you're like, okay, there's a lot of tweets. Here's who's involved, so what? But if you really want to look day by day and say, what's happening and why, like what's going on, what's driving this, August 10th is before the conference, August 11th is DSMA, August 12th is the first day of the conference, and that's when a couple other people join and start having conversation. And then the next day, a lot of new voices join. But after that first and second day of the conference, even though it goes on to like August 16th or 17th, the voices that are there are the ones driving the conversation. There's not a lot of people joining in the conversation later in the game. So when companies are thinking about how do we engage at a medical conference, you need to think about the timing of the medical conference because people don't have attention all the way through the end. Today's day 3 of MedX, who's tired? Yeah, everybody's exhausted because there's so much information coming at us so incredibly fast. So this helps us look at the data, not just who's participating, but how they're connecting and when they're engaging in a new and different way. And the other thing I wanted to do is I actually whited out all of the patients and the kind of others in the conversation. I really wanted to look deeply at the healthcare providers and say, what kind of people participate in AADE? I figured a lot of nurses, a lot of diabetes educators and nutritionists, but I was actually surprised that based on their Twitter profiles, there's a ton of other things represented here, people participating in the AADE and DSMA conversations. It's kind of fascinating. So again, I had all these preconceived notions going into this that were totally blown away when you actually drill down and look at the data, when you see that data evolving over time as you look at the life of the conference. So one other example I wanted to get to and then open it up for questions is to say there's a lot of things like popularity lists, like the HIT 100 or the top tweeters of the conference. And sometimes it's fun, you know, to say, oh yeah, I was a top tweeter, but you really want to think about impact, like who is actually impacting the rest of our communities. So I did an analysis on HIT 100, or actually my colleague Greg Matthews did, and we looked at HIT 100, which is this crowd-voted list of nominate people, and the top people kind of become the top 100 list. And as Greg points out, if these people really are that influential and that popular, it's not just important to know who they are, but it's also important to look at their behavior. Who are they following and paying attention to? Because those people are incredibly important. And what are the trends that they're on top of? Because that's stuff that we need to know about and we might otherwise miss. So what we did is we took that list of 100 people, and then we looked at their friends list, so the top 50,000 people that those 100 accounts were collectively following, and we did this analysis. And what's interesting is that the top 100 people most commonly followed 51 industry accounts. Those were the top followed accounts. And you can kind of look here. And one of the interesting things I see is that they're not commonly following a lot of patients. Not to say that they're not following patients at all, but in terms of the top most common accounts that these influencers follow, they're following doctors, they're following media, some advocacy, government, industry is overwhelmingly, but it was interesting to me that there wasn't like any one patient that was commonly followed by this group. And this group is also really inter-networked. So you can look and see that 95 out of these 100 people are followed by at least 25 of their colleagues on this list. 78 are followed by 50, 21 are followed by 75, so on and so forth. So these people are a really tight-knit network. And I've just got a visualization here showing just some of the faces. You might recognize them. Brianna here, Dr. Nguyen, Mandy, a lot of these people who, when I think about who are the influencers or who are the very vocal people in IT, these people are it, but you can look and see, here's how many people they follow and here's how many people follow them by comparison. It's a pretty high correlation. But the other thing we should look at, again, is the common people they follow who are not part of this 100 list. And if you're curious at seeing this list, we've got a blog post diving into this deeper, and we actually have the full list available to download, just because if you too are interested in seeing who should I be following in this space if I want to join the conversation or see who's influential, it might be interesting to look through that list. And I encourage you to ask questions and say, what questions did we miss at first pass when looking at this? What did you find interesting when you looked at this data? So I want to wrap up here, but I just want to leave you with a couple of reminders about what I think is really important, which is number one, we can do better than one-dimensional metrics. When you see a number of impressions, ask questions, ask for more, and ask why. And remember that the influence is not about the number of impressions, the number of posts, the number of followers, but it's really about the reach and resonance and relevance to a particular audience. So somebody may be really influential and relevant to one audience, but not so influential to the other. And it's really about which lens that you're looking at it through that you can kind of make a decision, and that decision might change over time depending on what you're trying to achieve or what you're thinking about. And then the final thing is, just based on my research, not all hashtags and online communities are created equal. They're very, very different. They have different motivations. They have different reasons for being and different reasons why people participate. And it's important to look at those before you too decide to participate in them. With that, I'd like to stop for questions. Thank you.
Question. Thank you very much for this insightful presentation. It was really, very, very informative. Most of the data that you've pulled from, is it coming from Twitter only, or are you also analyzing conversations taking place on Facebook and LinkedIn and other platforms?
I'm so glad you asked that. So a lot of what I showed today was Twitter primarily. Our team has the capability to pull any publicly available social data. So we will look at blog posts, we'll look at public Facebook pages, we'll look at LinkedIn when that's possible. That's changing a little bit. We look at websites, we look at YouTube, we look at all of that together. It really just depends on the time spent pulling the analysis, but the data I've shown here is primarily Twitter. Great question.
Hi, I love geeking out about Twitter. And I'm curious about the use of lists. So I didn't see it specifically called out, but do you also analyze, do people actually use their lists? Is that a good way to determine who's influential?
That's a good question. I have seen some people use lists personally. Like they add people to the list so they can follow 1 billion people and like focus on, here's the 50 people I really want to see their content of. I haven't seen anybody find a really good way to say, here's how we can quantify list and understand relevance. Just from my personal experience, I get added to the list all the time, but Twitter doesn't really easily show you who started the list and who else is on it. Like you kind of have to dig for it. So I haven't found an easy way to really quantify and say, does this matter? The number of lists that I'm on or the number of lists I follow. I haven't really found an easy way, and I'd open up to everybody and say, if you do, I'd love to hear the answer too, just because I haven't found a good way to use that data to be anything meaningful. Yes.
Hi, thanks for that. That was great. Just it's a bit of a question stroke comment. So is a lot of that data coming from the US? First of all, okay. And if so, what I'd be interested to know, and could be an expansion of this, is the world's greatest diabetes burdens are actually in Asia, Middle East, and Latin America. And it'd be interesting to see what kind of networks you're seeing, what your observations would be there in those geographies compared to the US, where everyone does have access to Twitter and so on, and access to physicians. And I think it'd be very interesting where the biggest burden of diabetes actually is, what is happening with those networks compared to, let's say, here.
That's a great question. We make some great research. So my data was worldwide. So we pulled in anybody using these hashtags. But one of the things we found is that Twitter is really popular in some countries in Europe and not at all in others. And ditto for Facebook. In some places it's banned. There's other networks that are less open, so you can't gather data from. So it'd be really, really interesting to do that, but you would have to do some filtering because some of it would happen publicly and some of this happens privately. And something else I want to point out too is I'm using all publicly available data. So when we talk about categorizing people, it's somebody saying, I am a person with diabetes, I am an endocrinologist, I am a researcher, publicly in a tweet or on their profile. there's a lot of healthcare conversations that happen in closed social networks or in private Facebook groups, and we don't have access to that data. There's other research that needs to be done to look at this, and this is really just looking at worldwide public conversations where you can observe that behavior, knowing that it's not meant to be a comprehensive picture of everything, and that would be really fascinating to see. Who raised their hand first?
Can you talk a little bit about engagement in different social networks? We find that more conversation tends to happen in Facebook and in private closed social networks than in Twitter. But I'd love to hear your observations as to how the different social networks differ in the level and quality of the conversation that's happening.
Yeah, well, I think it depends on who is driving the conversation. Is it a patient-driven, patient-networked conversation, or is it a company or a group putting out a Facebook post and trying to get engagement in that thread? I think it differs depending on how you're looking at it to be able to say, is this an apple or an orange or a potato? To me, those are a lot of different things, but you can look at engagement in different ways across these channels, and it's really up for you to come up with a worldview to say, this is how we're going to measure engagement on Facebook on a public page versus this is what we're going to look at for engagement in a small private Facebook group. I don't really have a recipe without having a look at the data, but I do think it's important to really think about the context and the goals and who's participating and the limitations of those channels before saying, here's how we're going to measure it.
Hey, Dana, I'm just curious if you've seen sort of attempts to hijack chats. And, for example, when I go to journalism conferences, you see people like determining, oh, this is a community of journalists who are following a hashtag. I'm going to start like hyping something, and then it gets taken over for something other than what it's for. So has that happened, and is it something that you foresee happening?
Yeah, it's a good question. So from my moderation of HCPs very early on, we kind of set a strong community expectation that you don't come in and what we call shamelessly self-promote. You don't spam the hashtag, and when you do, you get called out on it. Somebody sends publicly or privately and says, hey, do you realize there's a HCPs chat going on? Like, you can do this any other day of the week, but right now, this is a conversation. So in a lot of community chats, people will call it out and say, like, hey, this is our time to chat, like, come back later. But with conferences, I see that a lot, even with medX, is people are like, ooh, medX is trending. I'm going to come in and post all this random stuff. And Twitter is a free world. Like, you can't do anything. If they're truly offensive and violating Twitter's terms of services, you can block them. But that's as much as you can do other than say, hey, as a group, we're going to go block this person, or we're all going to say something to them and convince them that this is not the time. But there's only so much you can do, and that's important to know if you are trying to drive a conversation, host a community, is just be aware that that can happen and just figure out in advance how you're going to deal with it. Because when you're like in the midst of a chat or the midst of a conversation, emotions get high and you're like, get off my lawn. But oftentimes it's more effective to be like, hey, you may not know that HCPs meets every Sunday night at 8 p.m. Central, and you might find another time more conducive to having a conversation. But right now, like, we're on this topic. So there's different things you can do, but I think thinking ahead really helps address that when you can't fully control it. Yeah.
Hi, sorry I wasn't here earlier to support you. So following a little bit up on what Charles was asking, when you identify these influencers and you feel like you have an opportunity to participate in a conversation, is there any like one resounding tip you can offer for people that have been lurking but feel like they want to contribute without necessarily feel like they're randomly interjecting? Like, how do you recommend people actually start to participate actively instead of just listening and observing?
I'm so glad you asked that. So earlier I talked about the 1-9-90 model and knowing that there's 90% of these people are lurking and they're afraid to participate. So I think it's really encouraging people to say, hey, jump in, share me your questions. If you're not comfortable asking publicly, DM me. And come up with a lot of different ways for people to participate and be nice when somebody interjects, even if you feel like they're attacking you or they're just wrong. Again, going back to what Lindred said, is be nice and accept them. And Twitter is this wonderful flattening experience where anybody can tweet, anybody can reach out to you. And even if you don't disagree with them, or you don't have time to respond to them, be nice when you do get around to responding to them and say, oh, hey, thanks for your comment, I actually disagree, here's why, or tell me, like, why do you think that way? And just nicely engage them in a conversation, because not everybody's been on Twitter for 8 billion years. Not everybody is comfortable jumping out, and especially if you are an influential person. You are the leader of your company, you are a really influential patient, you lead a community, you lead a chat, you've been speaking on the stage. Be nice when people reach out, because it is a really big deal that they took that first step, and your response to them may make or break how they continue to do that in the future. And I think we all owe it to each other to support each other and be nice and constructive, and do unto others as you would want to do unto yourself, and so tweet back to those people how you would want to be tweeted if you were for the very first time tweeting. And I can say that's how I started. So before I started HCPs, I actually reached out to Lee Azzi at the Mayo Clinic and people at these other hospitals and said, hey, I'm just a student, but I want to hear from you. How are you using social media to work with patients? and I started asking questions, and they answered. And it was such an empowering feeling that, yes, I was a university student, and I was a person with diabetes. I didn't have fancy credentials. I didn't work for an organization, but everybody was able to join that conversation, and that's what Hicksum was born out of, which is you can be a doctor, a patient, a lawyer, a marketer, a caregiver, like you name it. We can all come to the table and have a really interesting conversation and learn from each other. And I think that's what's most powerful about Twitter is that flattening experience and that openness. And that's really the spirit of MedX with everyone included. And I would love to see that infuse other parts of the healthcare community online, other specific communities where we say this is a community, and just the rest of the conversations too.